If you are taking thyroid medication, there's probably a few things you were not made aware of. So I'm going to review a few different options for replacement therapy. The first and most common is generic T4, also known as levothyroxine. It is my least favorite medication. Manufacturers are often sourced outside of the United States, so I have concerns of quality issues. The other is that the different manufacturing, there is variable dosing between them. So if you have a medication that you're taking for 30 days, you're doing okay, and then you have a refill and you don't respond as well, it's probably a different manufacturer. And the pharmacy does not have to inform you when they do this. I prefer brand specifically. Synthroid is the most common. It's also, unfortunately, the most expensive. Insurance sometimes does not cover it, often does not cover it. But there are other options for brand that are about the same price point as a generic. And the first one is Synthroid, and the other is Levoxyl. And they work just as well. You have consistent dosing, so works out much better for patients usually. There is another option. It's called Tirosint. It's actually my most favorite option. Tirosint is the only T4 replacement that does not have aluminum in it. So if you're on this medication for 20, 30 years, that might be something that you want to consider. Another benefit with Tirosint is that they have a liquid version that the absorption rate is 15 minutes. So if you're struggling to wait an hour after you take your medication to eat, or you're on a multiple medications that may be interfering and waiting an hour is not conducive, then the liquid Tirosint is an option as well. Many do not know about that. Unfortunately, insurance usually does not cover Tirosint for whatever reason, but they do have cash pricing it's reasonable. Not if you're on a fixed income though. Usually it's about $65 a month. Tirosint does offer a copay savings card. However, some of the pharmacies do not honor it, so you'd have to kind of weigh your options there. But so I hope this information is helpful to you to make the best decision on the medications that you would like to take, and I will be seeing you again in more videos. Thank you.